Well, good morning, everyone. I'm excited to be able to join you alongside Dr. Jane Philpott, Chair of Ontario's Primary Care Action Team, which our government established in the fall, to share an update on the team's progress and the work that they have been doing to connect every person in Ontario to a publicly funded primary care team by 2029. Under the leadership of Premier Ford, our government has been making record investments in healthcare, taking bold action, and making innovative changes to connect people to the care they need when and where they need it. We are expanding capacity, reducing wait times, and wait lists by improving access to key services, such as primary care, diagnostic imaging, home care and hospital care in communities across Ontario, and taking action to maintain and expand Ontario's healthcare workforce. For a third year in a row, Ontario has added a record number of new nurses and new physicians, registering a total of 100,000 nurses and 15,000 physicians since 2018. Ontario leads the country with some of the shortest wait times for critical services, the largest physician and nurse practitioner workforce, the highest number of people with access to a regular healthcare provider, and we are not stopping there. Our government has launched the largest expansion of the medical school education system in over a decade, adding over 340 undergraduate and 551 residency spots, and opening 2 new medical schools in partnership with Toronto Metropolitan University and York University. We are creating new pathways to train more family doctors than ever before, by expanding the Learn and Stay grant to include family medicine, and introducing the Practice Ready Ontario program to license internationally trained family docs more quickly. Together, these programs will add nearly 1,500 new family doctors in communities across the province over the next 3 years. And we have taken the first step in expanding interprofessional primary care teams, including family health teams and nurse practitioner-led clinics, connecting nearly 330,000 more people to primary care in their community by creating or expanding 78 primary care teams, 72 of which are now open and taking on new patients. To continue to move forward to close the remaining gap of people who do not have access to a regular healthcare provider, and get across the finish line of connecting everyone in Ontario to more convenient primary care, I am pleased to announce our government is investing $1.8 billion to support the work of the Primary Care Action Team and their mandate to connect every person in Ontario to primary care by 2029. Through this historic investment, Ontario's Primary Care Action Team, led by Dr. Philpott, will implement an action plan that includes key initiatives and draws on best-in-class models of primary care being delivered across Ontario to ensure that no matter where you live in the province, you are connected to a publicly funded primary care team made up of family physicians, nurse practitioners, nurses, midwives, and many other healthcare professionals. The work of the Primary Care Action Team is another important way our government is building on our progress to create a more connected and convenient healthcare system by providing more people with the right care in the right place for years to come. It's now my pleasure to invite Dr. Philpott to share a few words and provide more details about Ontario's Primary Care Action Plan. Thank you. Stay well.
Good morning, everyone, and thank you very much, Minister Jones. I am so pleased to be here today with you for this historic announcement. Central to the health and well-being of every community is primary care. Primary care is your first point of contact with the health system when you need medical care. It's where trust is built between patients and healthcare providers, and where the foundation for long-term health is established. Whether you're talking about preventing illness, managing chronic conditions, or providing continuity of care, primary care clinicians, such as family doctors, nurse practitioners, etc., play an essential role in keeping people healthy. And it's not just about improving health outcomes, it's about improving the quality of life and the quality of health care for people. It's about creating a primary care system that works for both the people of Ontario and our dedicated healthcare professionals. So that is why the Government of Ontario is announcing today an investment of $1.8 billion that will connect 2 million more people to family doctors, nurse practitioners, and primary care teams by the year 2029. C'est pourquoi nous investissons 1,8 milliard de dollars pour aiguiller chaque personne en Ontario de connecter à un médecin de famille, une infirmière praticienne ou une équipe de soins primaires d'ici 2029. Through this plan, Ontario will build a primary care system that ensures that no matter where you live in this province, you can be connected to a primary care team made up of family doctors and nurse practitioners and other valued healthcare professionals, such as nurses, physician assistants, social workers, pharmacists, and many more. Through our primary care action plan, we are going to work with primary care clinicians, health system partners, and communities to connect everyone to more convenient primary care by 2029. Through the government's historic investment, we will be creating more than 300 new and expanded primary care teams that will attach approximately 2 million people to primary care. This includes over $235 million over this next fiscal year to establish and expand 80 additional primary care teams across the province, attaching 300,000 more people to care. As part of this work, we intend to connect everyone who is currently on the Healthcare Connect waitlist as of January 1st this year to a primary care provider by the spring of 2026. We want to make the process of finding a primary care provider easier and more convenient. Dans le cadre de notre plan, le gouvernement investira dans plus de 300 équipes de soins primaires nouvelles et élargies afin de donner accès à des soins primaires à environ 2 millions de personnes. Nous voulons également rendre le processus de financement des fournisseurs de soins de santé plus facile et plus commode. That's why we will be making improvements to Healthcare Connect to improve both the user and provider experience. As part of this, we will work towards a Healthcare Connect wait time target of no more than 12 months to be connected to a primary care team. We also want to ensure that patients can access their healthcare at their fingertips. As part of our action plan, we will leverage Health 811 to allow you to view online your health records, to book an appointment with your primary care provider, and discover your care options. We also need, of course, to ensure that we are supporting our primary care clinicians. This means continuing to address the administrative burden with digital tools such as AI scribes, modernizing the ways of information sharing, and improving the referral process to specialists. We know there is a lot of work to do to recruit and retain the workforce needed to support primary care providers and their teams, including family doctors, nurse practitioners, and other allied health professionals. This is just the beginning, and there is much more work to do in collaboration with our partners in primary care. This includes regular reporting on the progress we've made to connect everyone to primary care. Ontario is embarking on an historic opportunity to build a primary care system where the guarantee of access to a primary care team is as automatic as a child being assigned to a public school in their community. L'Ontario profite d'une occasion historique pour mettre sur pied un système de soins primaires où la garantie d'avoir accès à une équipe de soins primaires est aussi automatique que l'assurance pour chaque enfant d'être assigné à une école publique dans sa collectivité. This plan is ambitious, and the changes will not happen overnight. But when our shared vision is realized, we will have a primary care system in the province that has never existed before. Every person in Ontario, every baby, every child, teenager, parent, adults, seniors, will have a family doctor or nurse practitioner when they need one and can get ongoing, comprehensive, and convenient care. If you move within Ontario, you will automatically be offered a primary care team in your community, ensuring continuous access to care close to home. You'll be welcomed at the door, and there will be a team of amazing healthcare professionals working together to provide the high-quality care that you deserve, ready for you when you and your loved ones need it at all stages of life. That's our shared vision, and that is our commitment on this historic day. Thank you very much. Merci beaucoup.
We will now take questions from the media. If media present could kindly line up behind me and ask their questions through the microphone. As a friendly reminder, the format is one question, one follow-up. Please state your name and your outlet for your question.
All $1.8 billion are going out the door today. This is a campaign platform promise, right?
We have now got a plan in place to build on what we already announced last February. You know, when I talk about those 78 new or expanded primary care interprofessional teams that we announced in February of last year, we have 72 of those in place. Now, under Dr. Philpott's leadership, we now have a plan for the remaining 10% of Ontario's population that doesn't have a family physician, and that work starts today.
But if the Premier's calling an election on Wednesday, does that mean you won't necessarily be able to deliver on this plan?
Not at all. The plan is in place. That work will continue, and we now have that opportunity to build that excitement. You know, there's no doubt that people have been waiting a long time, too long, frankly, to get connected with a primary care practitioner in their community, and I am incredibly proud of Dr. Philpott's team in being able to turn around the proposal and the plan, bringing it to Cabinet, getting it approved so quickly.
Minister, it all sounds great, but the numbers don't add up with what the OMA says. The OMA says there's a 2.5 million Ontarians without a doctor now, and because of retirements and whatnot, that's probably going to go to 4 million in a couple of years, which means you're going to be about 2 million people short with this plan.
Dr. Philpott?
Well, I'm happy to provide some of details on this work that I've been working on in collaboration with Minister Jones and the entire team. We have been asked at the Primary Care Action Team to map out a plan, and we have actually worked very closely with researchers and academics to determine the exact number of people who don't have access to a family doctor or primary care nurse practitioner right now. We have, on the basis of that good work that's taking place, we have built a plan to attach 2 million people to care, and it is highly detailed, and that has been costed out and approved to be able to deliver that care to 2 million people. We will continue to update our numbers as we go along, and we will make sure that every person has access to care.
That's a pretty big gap, though. You're saying basically the OMA numbers are wrong. So now we've got like a 2 million gap between what the OMA estimates and what you guys are saying. So who do you think people are going to believe?
There are a number of organizations that have been attempting to figure out the actual number of unattached patients. What I can tell you is Ontario leads Canada in our attachment, and I trust those numbers. So we have, according to CIHI data, we have 10% of Ontario residents who are still looking for a primary care provider. Dr. Philpott and the PCATS team has put together the plan to make sure that we get there. As Ontario's population grows, we will ensure that we have the capacity in place to continue to match individuals, patients, families, young people with a primary care provider in their community.
I'd like to hear from both of you on this. First, Minister Jones. Dr. Philpott is supposedly in this nonpartisan role. It seems like you're using her as a political ploy for the election, and I'd like to hear from you as well on this, Dr. Philpott.
Listen, when we appointed Dr. Philpott last year, it was very much understood that we had a plan and we wanted someone who could implement that plan. And again, I will say, since she has come on board, since she has built that team, to be able to turn around and propose this $1.8 billion investment, ensuring that 10%, the last remaining 10% of Ontarians who don't have a family physician have that opportunity, I am incredibly grateful. and glad that we were able to move so quickly on this.
I'm happy to respond to that as well. So perhaps not everyone knows, I'm a family doctor myself and have been for almost 40 years now. There is nothing that is more important to health systems than to make sure that there is a robust primary care system where everyone has access to primary care. This government has taken a step that no other government in the country has done before, and to make a commitment and to build a plan so that every single person in the province has access to primary care. It is a tremendous honor for me to be asked to lead this team, to be able to have the resources of the Ministry of Health and Ontario Health to be able to deliver on the plan. There's nothing political about the work that is going on here. It is a plan to make sure that everyone will have access to primary care and that the system will be built for both now and the future.
Well, how do you feel coming out, though, 2 days before the election call, that they're bringing you out now?
I was appointed to this role in the fall. I started the work on December the 1st. It's been just 8 weeks exactly today. We have been working flat out. We intend all throughout the process to give updates. I'm very happy that today we have an opportunity to give an update on the progress and the plan that we've made, as well as the resources that have been allocated for this. And our team intends to work alongside the Premier and the Minister, whoever is in place, to provide regular updates on the work of the team.
It's a little awkward. This is $1.4 billion that is not budget money. It's a campaign promise, Dr. Philpott. Do you not feel that this is, not already, Ontarian money?
Please hold.
Respectfully, that $1.8 billion investment has been approved, and this plan will go forward. That work starts today. I just came off of 2 days of meetings with the Rural Ontario Municipal Associations, municipal leaders in communities across Ontario who are very excited and very interested in knowing what Dr. Philpott's work will look like in their communities. So I'm pleased that we've been able to share this information as quickly as we can.
Minister Jones, it's been a few weeks now since the Canada Health Act was updated to allow nurse practitioners to be able to be treated like physicians. In that time, can you lay out the concrete steps your government has taken to eliminate the for-profit nurse practitioner clinics that are currently in operation?
So you might recall that I actually wrote and spoke to the Federal Minister of Health and asked them to close this loophole. Today's announcement of $1.8 billion means that nurse practitioners have the opportunity to work in those multidisciplinary teams. We now have pathways for all nurse practitioners, all physicians, to be able to work in a primary care multidisciplinary team, and that work will start today.
So that means to say that you're not going to negotiate with nurse practitioners to create OHIP billing codes specifically for them, like the Canada Health Act changes now allows you to do?
What we are doing and what I want to see is opportunities for nurse practitioners who are training, who are in the province already, to be able to work in multidisciplinary teams. We know that patients get better service when they have the opportunity to work with multidisciplinary teams. The example I always give is when Mrs. Jones finds out that she has diabetes. In a multidisciplinary team, she now has that opportunity to sit down with the dietitian. If you are suffering from mental health illnesses, the piece where we have multidisciplinary teams, allied health professionals working together, it's what clinicians want to do, and it's what patients get better service with.
Now that you have the clarity that you have asked for, how quickly is the Ontario government going to work to shut down fee-for-service nurse practitioner clinics?
Today's announcement will ensure that there are many opportunities for nurse practitioners to work in multidisciplinary teams.
Take any action against
I would respectfully say $1.8 billion expanding primary care practitioners in the province of Ontario is huge action.
Dr. Philpott, sorry, can I ask about...
Can I get an explanation of why Cynthia Martineau was fired as the CEO of Ontario Health and Home?
Okay.
Is that an admission that your attempts to fix the supply problem have not worked?
We saw that there were challenges at Ontario Health at Home. Premier Ford and I were very clear that we wanted those fixed so that patients got the necessary supplies that they needed when they were being treated or recovering in their home. When we changed leadership at Ontario Health, we will continue to ensure that the process for patients, this is about patients. This is about making sure that people get necessary supplies as quickly as possible. And the leadership change, I think you will see, will ensure that that work continues.
If Martineau was at fault for this supply shortage, is this her fault?
I believe that when you see problems, you need to go to root cause. And as I've said, when we saw those challenges in some parts of Ontario where people weren't getting necessary supplies, we needed to act, and we've done that.
We've heard from the union workers, just quickly, Minister, one quick one on Ontario Health at Home, then to you. On this same topic, we've heard from the union workers that there are still shortages. So, we've heard months ago from the Premier saying he was going to be all over this. Months later, now we're hearing that, there's beds and mattresses that they're not available for home care patients.
So we have ensured that Ontario Health has been assisting Ontario Health at Home to make sure that those individual examples are dealt with quickly. We put in individuals working with Ontario Health at Home to make sure that as issues arose, we were able to respond very quickly to it. And we'll continue to do that because we know how important it is to have robust home care in the province of Ontario.
Dr. Philpott, you talked about the school zone, primary care, connecting people through their postal codes. I heard a little bit of that mentioned in your opening remarks, but it's not really in the announcement, so that's part of the new plan.
Yes, I'm happy to give you a brief overview of why we've chosen that approach, and will continue to do so. There are many countries in the world, nowhere in Canada, but there are other countries in the world that have 99 or 100% attachment to primary care. And if you look at those, every one of them has done it according to a geographic model, so that if you move to a new community, you can enter your postal code into your app or onto your website, and it will tell you the choice of primary care clinicians that are available in your neighborhood, and you will automatically be allowed to go to one of those. So that's the kind of model that we intend to develop here in Ontario. It will take some time to get from where we are now to that model. Thankfully, we have a lot of great mechanisms in place. We will be working alongside Ontario Health teams, for example, who are close to the ground, who know the neighborhoods, who know the primary care networks within their communities to be able to determine where the gaps are the greatest and where we need to invest these new teams.
Okay, we are heading into an election, as been mentioned. If, God forbid, the government loses this snap election, would you be willing to work with another party if they form government and they choose to keep you in the role?
I am very proud to have been appointed to the Ontario Public Service. I have a public service role as the chair of the Primary Care Action Team. I will continue to serve at the discretion of whatever government is in place.
Minister, the FAO says that it's going to cost $612 million just to put alcohol in corner stores a year earlier than originally planned. As Deputy Premier, do you think that's a good use of money? And as Minister of Health, do you think of all the good that it could have done going to a plan like this instead?
The investments that we've been able to make under Premier Ford's leadership, $85 billion that the Ministry of Health is tasked to ensure that people of Ontario get access to care. 50 capital builds across Ontario, 50 new MRIs, some in hospitals that never had an MRI before. We're making the investments in healthcare, and the other pieces and the other work that my cabinet colleagues and caucus are doing is about choice, about convenience, about catching up in Ontario to ensure that we look more like how you can procure in other Canadian jurisdictions.
So how did the government get that cost estimate so wrong on booths and corner stores? Minister, how did the